Now let's look at the evidence for the length of emergency department and post-emergency department cardiac rhythm monitoring of emergency department syncope patients. We analyzed 5,581 patients, of whom 207 patients suffered arrhythmias. The type of arrhythmias include sinus node dysfunction, new or uncontrolled atrial fibrillation, high degree AV block, ventricular arrhythmias, and supraventricular arrhythmias that do not fall under the atrial fibrillation category. And the outcomes also include interventions for arrhythmias such as pacemaker or defibrillator insertion. Patients who died due to an unknown cause were designated as having died because of an arrhythmia. Looking at the timing of this arrhythmia occurrence, very small proportion of the very low risk and the low risk group patients suffered arrhythmias. Among those who suffered arrhythmias, about half of them were identified within 2 hours of ED arrival. Looking at the medium risk, a little bit higher proportion suffered arrhythmias, and half of them were identified within 6 hours of ED arrival. For the high and the very high risk group, a higher proportion suffered arrhythmias, and approximately again half of them were identified within 6 hours. Based upon this, we think that 2 hours and 6 hours of monitoring based upon the CSRS risk category will identify at least half of the arrhythmias. This slide shows the proportion of medium and high risk patients who suffer arrhythmias in the 30 days following the emergency department visit. The timing of the occurrence of these arrhythmias is also shown from 0 to 30 days. As shown in here, the highest chances of detection of arrhythmias is in the first few days following the emergency department visit, and up to 91.7% of arrhythmias happen within the first 15 days, and also all ventricular arrhythmias happen within the first 15 days. Hence our recommendation to consider 15-day monitoring of medium and high-risk patients when they are discharged home. Now, for patients who are going to be monitored as outpatient, when should be applying these devices? This graph shows a Kaplan-Meier curves for the 3 risk categories of low, which is in the blue line, which represents the low and the very low risk groups. The red line represents the medium CSRS patients, and the green line, high and the very high risk patients. The graph shows the occurrence of arrhythmias within 24 hours of ED arrival, and each crossbar within the line represents a patient with arrhythmia. As you can see, the best possibility of identifying an underlying arrhythmia is immediately after patient arrival and the hours following emergency department discharge. Hence, we recommend that arrhythmias are more likely to be identified immediately after the ED arrival and after discharge. Hence, these monitoring devices should be applied before emergency department discharge. Now we go to the survey part, wherein we will be asking a bunch of questions to elicit your thoughts on using the Canadian Syncope Risk Score. For all survey questions, please assume that we are talking only about patients for whom there are no serious underlying conditions that are identified, or one that is evolving in this patient, and they do not require hospitalization for social reasons such as unable to cope at home or need for hospitalization for pain related to fall, and also assume that all of the patients have stable vital signs. Now let's look at the patients who have been categorized as very low or low risk. The overall 30-day serious outcome probabilities range from 0.3 to 1%. None of the patients suffered death due to an unknown cause or a ventricular arrhythmia. The probability of supraventricular arrhythmia ranges from 0.1 to 0.4% and non-arrhythmia 0.2 to 0.6%. Overall, 1 or less than 1% of patients suffer serious outcomes in this group. Given that probability of serious outcomes, we recommend that these patients can be discharged home without further cardiac monitoring or specific follow-up, with instructions to return to the emergency department if signs and symptoms of serious underlying conditions occur. What do you think of this recommendation? Please answer below.